Good afternoon, everyone, and thank you for joining today's webinar, Mapping the Road Toward Increased Accessibility to the Child Tax Credit. This webinar is made possible through the generous support of the Rockefeller Foundation. My name is Vanna Cure, and I am the Associate Director of Advocacy here at Prosperity Now. I am also managing a new Rockefeller-funded cohort of 5 vital organizations focused on expanding CTC outreach efforts, which this webinar will be a kickoff point to that cohort that we are starting. Now, before we get started, I'd like to go over a few housekeeping items for you all. First thing is this webinar will be recorded and made available to registrants. All webinar attendees are muted to ensure sound quality, but as always, we'd like to try to ensure that these webinars feel as interactive as possible. So please ask questions or share your thoughts anytime by typing into the text box of your GoToWebinar control panel. And then lastly, if you're experiencing any technical issues throughout the webinar, please email the address that you see there on the screen, gotomeeting@prosperitynow.org. Lastly, in order to get the most out of today's webinar, we encourage you to join us from a quiet space so that you can hear. Just settle in, grab a coffee, grab a snack, settle in and listen, take notes, engage with us. As I mentioned before, send us your questions, your comments as you listen. Tweet with us on Twitter using the hashtag ProsperityNow. And then lastly, reflect on ways to apply what you learned today to your own work. At this time, I'd like to introduce you to today's speakers. Our first speaker is Richard Auxier, who is the Senior Policy Associate for the Tax Policy Center. Yvonne Avila, who is the Research Analyst here at Prosperity Now. And then Debbie Stein, who's the Network Director for Partnership for America's Children. I am really excited to hear from today's speaker. Great lineup of experience where we will go through data, messaging, and outreach strategies for getting more families access to the child tax credit. Before I turn it over to our speakers, though, I wanted to talk a little bit about why we're here, why we are doing this particular webinar. Of course, the expansion of the Earned Income Tax Credit and the Child Tax Credit last year provided critical economic relief to millions of struggling households across the country. However, we recognize that there are tens of millions of households across the country who don't file taxes due to a variety of different barriers that are standing in their way. And with that, we recognize the urgent need for free tax prep service providers to reach these first-time and lapsed tax filers using some innovative outreach and messaging strategies alongside the alternative service delivery methods that they were already doing in 2021. So like virtual VITA, hybrid models of tax preparation. And so in order to recognizing those things, on today's webinar, we want to share geographic data with you all on where families are most at risk for missing out on the child tax credit and where income poverty exists the most across the country. We also want to discuss ways to expand our messaging and outreach efforts to remove some of the barriers that we're seeing to non-filers accessing the benefits of the expanded child tax credit. In terms of today's agenda, in just a moment, I'll ask a poll question to give us a better sense of who is on today's webinar. And then I'll turn it over to some of our data specialists, Richard and Yvonne, to talk through data. And also to introduce you all, to tell you all a little bit more about the areas across the country that Prosperity Now is going to be working in. And then Debbie will join us a little bit later to talk about some findings that they found in doing some focus groups focused on CTC outreach. And from there, we'll have questions. But like I said, please feel free to ask your questions throughout today's webinar. We do want to hear from you and hear your thoughts and your comments as well. So before I turn it over to Richard, I want to do a quick poll question to see sort of what you all are working on in your respective communities. So please take a moment to answer this poll question. Is your organization or coalition doing targeted outreach to help lapsed filers claim either the CTC or stimulus payments? So please take a moment to answer our poll question. And the responses are yes, not yet, but we'd like to, or no, we don't intend to. All right, it looks like a majority of you, 55% of you, are saying yes, you are doing some targeted outreach. 29% of you said no, not yet, but we'd like to, and then 15% of you said no, and you all don't intend to. So thanks for taking a moment to answer that poll question. So without further ado, I will turn it over to Richard to kick us off. I know we've got a big agenda today. We've got a lot to cover, so I'm going to go ahead and let Richard kick us off in talking about the Tax Policy Center's data, which really was the catalyst or the starting point for how we were able to select members of our cohort here at Prosperity Now. So Richard.
Awesome. Thanks so much for that introduction, Vanna, and really appreciate you inviting me here to try and help. My name is Dr. Auxier. I'm a Senior Policy Associate in the Tax Policy Center, and what you're looking at is a map of the United States that is showing where children are at risk of missing out of the child tax credit. This data, though, is actually, it's Treasury data. It's Treasury data that the Treasury Department put out in the summer of 2021 as part of their effort to help outreach efforts like the ones we're discussing today, and find places where there are families eligible for the child tax credit who might not have a connection to the tax system. And that's what this is. It's a snapshot of data from a point in time. And what it's showing is these are households where someone has health insurance because this family got a form, 1095, which was created as a part of the Affordable Care Act when there was a penalty for not having health insurance. And this goes to you if you have private insurance, employer insurance, and maybe most importantly for our purposes, Medicaid. So we know that these families exist because they have been contacted with that 1095 form to say that they are getting health insurance. But we also know that they have not filed a tax return in tax year 2019 or 2020. So again, these are families that exist, these are families with children, but who are not filing taxes in the 2 years leading up to 2021. And then so what you'll see on the map below are blue. There's two ways to see these data. There's zip code level data, which makes it really good as a way to get down and get a really close examination. And zip code level data showing these 2.3 million children who appear on healthcare forms, but not on tax forms. And there's two ways to see this. There's the share of children, and there is the total number of children. And I don't know if I have control of the map. No, I don't. But if the user could go and click in maybe like on a state. Okay. Regardless, something to quickly, okay, now hopefully everyone is seeing my map, and it's showing North Carolina, and it's showing zip code level data of where these children might be at risk. And there's two ways to look at this data. There's the share of children and the total number of children. We'll go with the simpler metric. This is just total number of children, where the highest number of children per a zip code. And if you can see as I follow along, if you go along these North Carolina zip codes, you'll see that, so for right now I'm in 27516, there's 221 children. If you go further, you'll see there's 245 children. In zip code, see if we can get to a dark blue one, in zip code 27587, there's 527 children. This is the biggest benefit of the map, is this local, is getting this really local look. The shades of blue are merely to draw your attention. This is specifically important if I zoom out a little bit, again, and go back to the United States map, because we also, did this as share. And when we say share, what we're talking about is a zip code's share of the children within the state. That's why you'll see a lot of blue in Wyoming. Wyoming is not necessarily a problematic state for accessing the child tax credit. It just has very few people, and so it doesn't take much. And it has very few zip codes, so it doesn't take much for any zip code to have a relatively high share on our map. Again, the blue is just a way to draw your attention, because we wanted this tool to be able to do is for specifically state and local organizations to understand where in their state there are elevated numbers of children who, again, we know are getting health care but are not in a family that is filing taxes. We did take a look and did an examination of the top 50 zip codes that are in here, and we found that the zip codes most likely to have relatively high shares they were disproportionately Latino. They were disproportionately immigrant. And again, this goes from the fact that that's a good way of segueing into this data, again, is somewhat limited. It is only looking at states, excuse me, it only is reporting families that have health insurance. And so, first of all, if a family doesn't have health insurance, they're not in the data. And that would apply to, for example, families where you might have mixed citizenship status, where they're not accessing healthcare because of public charge concerns. They're not going to be in it. It's also not showing families who have had children since 2020. Any new families are not going to appear in this data. Again, it's only for healthcare in 2019, filed taxes in 2020, and not filed taxes in 2019 and 2020. Again, apologies to go back. The characteristics of the zip codes with high levels. Again, disproportionately large share of Latino families, disproportionately large share of immigrant families. Not surprisingly, large shares of poverty. And then also we found a lot of zip codes where there's large concentrations of Orthodox Jewish families also appear to have high counts. Because again, what this is really just showing you are places where we know that there are a lot of families who don't have a connection to the tax system, or at least did not as of 2020. And therefore, these are the types of families that we think might be at risk of not getting their monthly CTC checks or possibly filing taxes this year to get their full child tax credit. And with that, I think that's all I have. So I will try to stop sharing my screen. Okay, thank you.
Hi, y'all, and thanks for that, Richard. And good afternoon, everybody. This is Ivan Avila, Research Analyst with Prosperity Now, and I'll talk to you. If that map wasn't enough, we have another map to show you all today. And so, after seeing the great work done, by our partners at Tax Policy Center, Richard and again, Prosperity Now decided to build upon the efforts and develop a tool that can be used by our field partners to make decisions around where their outreach efforts are needed most. And so the way we did this is we took the Treasury data that Tax Policy Center used on children at risk of missing out on the CTC by zip code, by share of the zip code, and layering in household income poverty data. And the household income poverty is the percentage of households below the federal poverty threshold. So this gives us a view into the population that are most at risk of missing out on the CTC and that are also in most need of the life-sustaining dollars the CTC represents. And so we took both of these outcomes and uploaded them onto a mapping software to create a layered map of the US by available zip code, similar to the map that you just saw. And so this allowed us to create a map of the US similar to the Tax Policy Centers. Unfortunately, we weren't able to replicate the same functionality of the map currently on the TPC's website. And so, as Richard just showed you all, he was able to zoom in on the zip codes and click on the zip codes and, show the available data. The map that we created, unfortunately, doesn't have that, but we did create several iterations of the map, like the one that you see here of the US, just by different US regions, as well as the regional service areas of the partner organizations in our cohort. And so now with both outcomes in one map, CTC at risk rate and income poverty, we're able to zoom in on some of the geographies with the greatest financial need. So zip codes with a higher rate of children at risk of missing out on the expanded CTC by zip code, and households below, a percentage of households below the income poverty threshold. And so in addition, this tool aided in our selection process for the cohort cities participating in this initiative. And so other than using this tool in our selection process, we also wanted to share it with you all via several iterations and a map and a zip code locator tool to help provide additional context around areas of the most need for services and support. And so we uploaded these US region maps as well as the cohort geographies onto the Prosperity Now website. And so we'll walk you through that in just a moment as soon as I'm able to get control. Okay, thank you for that. And here is the website. And so the top of the page here, as you can see, is titled, mapping the road toward increased accessibility to the child tax credit. It gives, the site here gives some additional context as well as ways to navigate the site for the regional maps, our VITA program partners, And so the thing that I'll draw you into first that I want to make sure to cover is the map legends. So, we can better give some additional context as to how we layered both of these types of data, right? So as you can see, we have this map legend consists of 15 different color gradients ranging from data with just CTC to data with just income poverty rate, and then both of these pieces of data layered onto each other, right? So on the right, you'll notice this, sort of pinkish hue, and this represents CTC, right? So CTC at risk rate for the specific zip codes, right? And this ranges from 0 to 2.4%, all the way to 3.4% to 100% percentage of risk of missing out on the CTC for that particular zip code. And again, this is share of population of children within that particular zip code. And so that is for CTC. On the bottom here in the yellow, as things go from white to more pronounced shade of yellow, this is for income poverty rate, right? So as things get more yellow for specific zip codes, the higher the income poverty rate will be for that geography. And so in our map, if you have zip codes with just a sort of pinkish hue on it, these are zip codes with higher rates of CTC, high to mid rate of CTC at risk rate, but perhaps maybe a low to not really a pronounced income poverty rate. Versus if you have yellow hues, this will indicate mid to high income poverty rate, but very low to no at risk of CTC. But when you combine both of those things together, we start getting this orange to dark red-ish hue that you see on the legend map as well, right? So if we focus on one of the sort of the color gradients in the middle, you'll notice that CTC rate here for this gradient, for example, in sort of a light orange is 2.4 to 3.4% at risk rate, and income poverty rate is 6.5 to 9.9% of households for that zip code who are below the poverty threshold, right? And so as things start to get more severe, you'll notice the gradient at the top rightmost piece of this legend, income poverty rate 15.4% to 100% as that threshold, and CTC rate 3.4 to 100% for that specific threshold. So zip codes in this color gradient are the most at risk for both of these different outcomes. And so this process, creating these gradients, these thresholds, and ultimately the maps help guide our selection process for the cohort cities, right? And so I'll walk you through their maps here on the page. So we have Kaiba in Philadelphia, Pennsylvania, as you can see, and you'll notice the trend across all of these maps that they're roughly at the higher end of the spectrum for this legend. For the color gradients, which again, that orange sort of bright red, meaning that there's higher rates of children at risk of missing out on the expanded CTC for that zip code, as well as higher rates of income poverty across households below the poverty threshold, right? So this is Philadelphia Neighborhood Improvement Association in Savannah, Georgia. Again, you notice that trend again here. Catalyst Miami in Miami-Dade, Florida. And this is for Miami-Dade County, since these try to make these maps relevant of the service area for these specific regions. So this organization serves the entire county of Miami-Dade in Florida. Association Housing Partner in Cleveland, Ohio, and finally Tax Help New Mexico and Albuquerque, New Mexico. And these our partners here serve a wide variety of zip codes across the state of New Mexico. And so we created these individual maps for each of our cohort cities, but we also have regional maps for different regions across the U.S., which are here. This is the U.S. map that you've already seen, but we also have some for the Pacific Northwest. We'll zoom in here for this particular geography, and Southwest is another one that'll also so different regions, different regional areas of the U.S. that are zoomed in, again, because we didn't have the same functionality available to us that at Tax Policy Center have, where you can zoom in and click on the website on the specific zip code and get the data. But we do have this tool that allows us to get data by zip code. So if you enter in a zip code, it'll give you the data on CTC at risk rate as well as income poverty rate for that specific zip code if data is available. So for example, this one that we already have preset here for zip code 31419 in Savannah, Georgia. The data for this zip code is child tax credit at risk rate is 4.06% and income poverty rate at 9.17%. So if we use our legend, we can see that those both of those fall up roughly under this threshold, which indicates, of course, it's on the higher end spectrum for both of these factors, right? So more higher end of for CTC and higher end for income poverty rate. And I'll also note that for this zip code locator tool, we won't have, based on treasury data, based on census data, there won't be data available for every zip code. So you don't want to keep that in mind as you all use this tool. And so I'll pause there and let Vanna and transition over to Vanna to see what questions you all might have for us.
Great, thank you both Yvonne and Richard. And I wanted to pause here. I thought it would be a good time to pause before we get a little bit more into the qualitative data and talk about messaging strategies to see if folks had questions specifically about the data. And I did see a question here that I believe is directed towards Richard, so I'm going to kick it over to you, Richard. So is it counting children who are receiving some type of health care versus on a tax return?
Right, exactly. And something a detail I should have put into the first presentation that I always seem to omit is that remember that because of the Affordable Care Act, if you have health insurance, the government sends you a tax form of it. That's the 1095. And so, for example, if you have no connection to the tax code, but you're getting health care, and for us possibly getting it through Medicaid, they are sending you a tax form that is saying you had this. That doesn't mean the family had to do taxes. And in fact, the children that we're counting are we know that they exist because they're on that health care form, but they didn't appear on any tax returns in 2019 or 2020. And so therefore, that's why we're assuming that their family is not filing taxes and they have no relation to the tax code, and that if someone could find them, they would be eligible for this child tax credit and benefit from it. Does that work?
Great, thank you, Richard. I also saw another question here from Angelica that I'm going to just slightly pivot from. I know that, Angelica, you were asking if we can click on New Mexico specifically. To all of our attendees, we dropped the link to both Tax Policy Center's tool as well as Prosperity Now's tool in the chat. So please feel free to use those live links to go and search data for your specific zip code. And then one more question here, Patsy, I see you have a question as well. We're going to do Q&A again at the end. But really quickly, David is asking, is the financial/tax data publicly accessible, perhaps through data.gov?
So I'm not sure about that, but if you go to the tool, and as Vanna mentioned, they've sent around the link, you have the ability to download the data. And that is the data, that is the Treasury Department's data, which we are presenting to you, which I'm not sure if it was made public available or sent to us. I apologize, this happened a year ago, so I don't quite remember. But you can get it through the map, and you can download it either for the entire country or for a specific state. And that will give you the Treasury count of children who had health insurance, but we're not on a tax return. Plus, we have some other data about those zip codes in there from the American Community Survey and some other information. And so that's all available on our website to download.
Great, thank you, Richard, and thank you both, Yvonne and Richard. We're going to come back to you all because we have several more questions for you all in the chat. We'll come back to you at the end of Debbie's presentation, but I'm going to move us along here. And just some additional context for the data that was just presented to you all. With this data, the Tax Policy Center's data, and then Prosperity Now's data on where kids are missing out on CTC, as well as income poverty rate, we at Prosperity Now were able to identify organizations in 5 key cities that we identified from the data. So Philadelphia, Savannah, Miami, Cleveland, and Albuquerque, which Yvonne showed you on the map. So we identified these organizations to focus on enhanced outreach strategies and service delivery methods to groups who could benefit the most financially from free tax prep assistance through VITA sites, but are least likely to file taxes. And so in working with these cohort groups going forward, we're going to be assessing why key groups are unaware of the available of the availability of VITA or free tax prep sites. Thinking about how best we can reach these groups and with what messages, how best to provide them with tax preparation assistance in 2022. Do we need to think about virtual services? What are the barriers that exist that prevent them from accessing virtual services? But the entire goal is going to be to remove these structural barriers to filing and receiving the CTC, the Earned Income Tax Credit, as well as stimulus payments. So please, I would encourage you all to use the links in the chat to examine data for your own zip code as you think about additional outreach strategies for your own community. And so now we're going to shift gears a little bit and talk qualitative data. I'd like to turn it over to Debbie Stein to discuss findings from recent focus groups that were done in partnership with the Coalition on Human Needs and Lake Research Partners to examine how messaging and existing outreach strategies resonate with parents and service providers. So Debbie.
Thank you so much. And let's go to the next slide. We undertook this research as part of a project called Connecting Children to Child Tax Credits, which is a joint project of my organization and the Coalition on Human Needs. And the research itself was conducted by Lake Research, which is headed by Celinda Lake and Alicia Snell. And they've done a lot of good focus group research for us on this and on other projects with similar populations, which is why we chose them. Next slide, please. We wanted to do this research because we knew that the families that are not getting the child tax credit also didn't claim their stimulus payments. And we knew that they knew the stimulus payments existed because they got such wide visibility, and it was a huge matter of public debate. So just knowing that there was money out there that they could claim clearly wasn't enough to get people to go claim the money. There was some lack of information, there were barriers. We wanted to understand what they were so that we could help families understand how much money was coming to them if they claimed the child tax credit. So we conducted 8 focus groups. 2 of those were in person in Oklahoma, and one of those was with parents who are experiencing homelessness, and one was with white parents. In every one of our focus groups, we specifically looked for people who had not filed a tax return in 2019 or 2020 and had not claimed their economic stimulus payment. We didn't just ask them if they hadn't gotten their child tax credit, because we learned from someone else's research that if you just asked that, you got a lot of people who had filed but hadn't gotten their payment. We wanted people who had never filed. And then we did 4 online focus groups with parents, one with Black parents, one with English-speaking Latinx parents, one with guardians, meaning people who were raising children that were not their children. It might be their grandchild, it might be a younger sibling, someone who is eligible for the child tax credit, but not the immediate biological or adoptive parent. And then the last one was with Spanish-speaking undocumented parents to try to get to some of the issues for undocumented people and learn how strong those barriers were. And I will say as a side note that many of them did it without showing their faces, just to give you a sense of how afraid they are. And then we did 2 with service providers, because we also wanted to understand what messages would engage service providers in reaching people and recommending that they file for the credit. Next slide, please. So there are some limitations to this research, and I just want to make sure you have them in mind as I talk about it. Most importantly, it's not a survey, it's not statistically significant. I can't tell you for each of the things that we learned how many people it's true for. And that, you know, if the CTC gets extended into a future year, we will try to raise funding to do a survey because we think that's important. But we didn't have the time to do a survey and still have our data be usable, because you really need to do focus groups first. So we did the focus groups to try and understand the issues, and hopefully we'll be in the fortunate position of having more years of the credit and be able to do a survey at that point. The other big way that this population is not typical of the groups you're reaching is that they're comfortable online, most of them, because we did 4 out of our 6 focus groups with parents online. And so this research is not going to be as helpful for people who are not online, although we did 2 in person, and so some of our findings definitely are useful for them. Next slide, please. So here's the key findings and recommendations. Next slide. First of all, one of the big barriers is that people really are not familiar with the child tax credit. They've heard of it. They particularly heard of it, of course, when there started to be advanced payments, but they don't really understand the details. And in particular, they don't know how much money it is. They don't know that it's more money than prior years. They don't know that people are newly eligible who didn't used to get it before. So defining it, explaining that it's more money, explaining that people who weren't eligible before can get it now is really a helpful piece of information to give. In particular, a lot of parents and guardians think they're not eligible. Because it's called a tax credit, they think they have to file taxes to get it, which is true, but they think they have to be required to file taxes. If they don't think of themselves as a taxpayer, they don't understand that they can get the credit just by filing. They think they had to have had earned income because that goes with paying taxes and it's a tax credit. And a lot of them thought they had to have the Social Security number. As I hope you all know, to get the new child tax credit, the 2021 one, the adults in the household can file with an ITINs and get the CTC. The child must have the Social Security number. So for immigrant families, that was a barrier. We also found that a lot of the people who were caring for a child that wasn't their biological or adoptive child thought they needed to be the legal guardian. And that's not true. So long as they have the correct biological relationship, they don't need to be the legal guardian. And so for that population, that information is important. I will also add that even when they knew they were eligible, many of those families were unwilling to claim the credit because of a variety of challenges that it might present with the parent of the child who was claiming the child and claiming the credit. If the parent wasn't claiming the child, they didn't see a barrier. But if the parent had already claimed the credit, they didn't want to make problems for that person who might be their child. They hoped that the person would use that credit to get financially ready to be able to take the child back, or they were just afraid that the parent shouldn't have the child but would try to take the child back in order to get the child tax credit. So there's a set of problems around family structure there that just messaging isn't going to resolve. There was also a very big concern among a lot of our focus groups that they were going to have to pay back the monthly payments or any child tax credit. Some of them thought it was a loan because of the term advance. Some of them were afraid that they would make an error. Some were afraid the IRS would make an error, but they still had to pay it back. A couple of them had seen that in the tax arena, but I think, although they didn't say it, they've also seen that in other benefit programs like SNAP, or they were afraid their eligibility would have changed. There is a protection against repayment in the law, and when we used a message about that, which I'll show you later, that did reassure people. People were also afraid to file because of consequences. They thought they hadn't filed in past years that they owed money to the IRS, or they were afraid in the case of undocumented people that their information would get shared with ICE. And we found messages that help with that. And then finally, people were afraid to file because they thought, well, I'm on disability and I'll lose my disability because this will count as income, or I get SNAP, I don't want to lose my SNAP. That's not true. The law prevents the child tax credit from counting as income for any federal benefit. Next slide, please. So I want to talk a little bit more about some of the concerns, particularly for immigrants. A lot of the immigrant parents were very concerned about their information being shared with ICE. And that level of fear, as I said, was very strong. Some of them didn't even want to research it because they were afraid that if they went online and researched it, ICE would somehow learn that they were looking into it. As I said, a lot of them didn't want to show us their faces when we did the focus group with them. Even if they were documented, they're worried about the public charge issue. They're afraid that if they get a benefit like the child tax credit, that when they then try and get a green card, if they're here on a different set of legal documents, or if they try and become a citizen, that the government will hold that against them and say, you can't do it. Currently, no public charge applies to this. This isn't considered a public charge, but people were understandably afraid that the law would change on that. We talked about the confidentiality guarantees, and it's good to tell them that, but people were still not confident that their information would remain confidential. We didn't test, and I wish we had, a message that said that millions of people file with ITINs every year and have no problem. But that might be one you'd want to try. We did also show them the list of documents that they needed to use the online simplified portal, and that was good news. Most parents thought they would have those documents and it would be easy to use that portal. Next slide, please. So then we tested what would reassure people and make them more likely to apply. One of the things that we weren't necessarily expecting was that people really, the first place the people who are used to going online would go is to the IRS website, because they figure that's the government agency running the program and that's where you can get good information on it. One of the things we realized from that is that as you put out materials, it's a good idea to include links to the IRS website so that people feel confident it's not a scam. They also trusted state government agencies and programs like WIC, SNAP, so you may want to partner with your state or local government agencies to get them to get the word out. And they trusted teachers, childcare providers, doctors, other people that serve their families regularly. A lot of people felt they needed help to apply. And I think that's where Vitus sites are in a really good position, but you may also want to partner with teachers, childcare providers, service providers in your community. And we actually have a toolkit of resources you can give those agencies, so they don't need to be tax experts, they just need to get the people to you. I will say people also wanted the IRS to automatically enroll them, which is, after all, what was happening to most people. And they felt their information was on file with the government, but of course, if they're not taxpayers, it's not in that particular system. We are, in fact, trying to get the government to do that for future years, but it's not going to happen this year. We asked them who they would turn to, and they did say they would go to tax experts in their community. They would talk to other people who have already applied. And notably, the immigrants said they'd talk to their immigration attorney. So we do recommend you reach out to your local immigration bar association to make sure they know how to answer questions about the CTC and filing taxes in general for immigrants, and that they'll make referrals to you. Next slide, please. So we put together two message triangles. This first one is one that you could use with parents and guardians, and it has three messages. The first one on the left is basically a straight explanation of what the program is, so that people will know they're eligible and that they don't have to pay it back, even if there was a mistake, so long as their income is pretty low. The one on the right uses messages that we tested about what would convince them that it was a good idea. And I want to stop here for a moment and say that messages that talked about the cost of raising a child and how the credit would make it easier for the parents, would give the parents breathing room or the caregivers breathing room, were very effective. Messages about what a big difference it would make in their children's lives did not work. Messages that said your kid's going to do better in school, is more likely to graduate from high school and go to college and earn more as an adult. Parents didn't believe it. They thought it was way overselling it. But they also said, you know, I think what really matters in how my kid's doing is how I raise them at home, not how much money I have. And so those research results are real. This can have a huge impact on kids' lives, but it's not a good message for trying to persuade people to apply. It was somewhat more effective with service providers, who I think didn't take it as a personal reflection on their parenting. The third message is a general one about how your information is kept confidential, and that was an important one to give, not just to immigrants, but to everybody. I will add that we know from other research that people are afraid that their records might get to their landlords, for example, and then their landlords will live in overcrowded housing. So information that you're in, is confidential. That message is very helpful. Next slide, please. We've also got a message triangle you can use with providers. And the three themes there is, one thing you can do, and you do so much for your families, one thing you can do is the child tax credit, how much it helps. That did work with providers. One is, even one more thing sounds like a lot, but a few minutes getting them to apply really can help them. And the third one is playing on the essential role, the way that families trust them, and because they're disconnected from other news, it's important for these trusted providers to help them reach out. Next slide. So we also tested other messages that worked well for parents and guardians. The first one was sort of framed around the way the tax credit was originally, the first half was being paid out monthly, but it just kind of emphasizes how expensive kids are and how the credit can help you with all of these. Whether or not you're getting the monthly benefit, you'd want to tweak it now that the monthly benefit's over. There's a message that we tested that worked pretty well specifically for undocumented immigrants that talks about filing with an ITIN and how protected this is. And we also tried one that worked pretty well that said it's not a tax or a loan. It has no strings attached. It could really just be called child checks because it's like getting a check just because it's your child. And it emphasizes again that it's helpful to pay with the cost of raising kids. Next slide, please. There were also some things that really didn't work out. If I was rewriting the last message on the prior slide, I would take out the don't miss out language. People didn't like that, although they did like language like wiggle room or breathing room. They didn't like it to sound too much like an ad, too commercial, too cheesy was a phrase that came up a lot. And they were very hesitant about the prohibitions about sharing information, even after we gave them good information about that. And they just don't like the idea that a little bit of money can change someone's life. So we'd recommend against using the messages here. Although the not hard part didn't work as well as we had expected because providers felt it was pushing them too hard to help. It was very effective with non-school providers, so homeless shelter people and like that, but the teachers and the childcare providers were not comfortable with the message about it's not hard, you don't have to be a tax expert. It was very interesting that different kinds of providers had different message effectiveness. Next slide, please. So this just kind of summarizes our recommendations for working with parents and guardians. Define it, tell them who's eligible and how to apply, provide some reassurances, particularly for undocumented people and people that are homeless, give them materials that meet them where they are, and use messages that include parents like you, covering what your family needs, taking care of your child. Focus on the role for the parent, not the child, and don't oversell, in their view, the effects. Next slide. For providers, again, they need the essential information. Tell them where they can go to you, really, the VipaSite providers. If you can give them case studies to show that it worked, somebody else in their community. Providers really need resources they can hand out to parents and digital resources to share with people they don't meet with face-to-face. And don't overpromise and emphasize that it won't take them a lot of time. They can do this pretty quickly. It's also a good idea to remind the providers that the child tax credit can help people who are on fixed incomes, like grandparents and people with disabilities, because a lot of those people weren't eligible in the past and don't realize it changed. Next slide, please. Just a couple of other things I want to go over, and then we'll go to questions. That was all our research. There was also research that was released literally 2 weeks ago with low-income non-filers that was conducted for Golden State Opportunities, and they did 5 online focus groups with 30 non-filers in 3 different languages. And what they learned was there was a pretty significant distrust of VipaSites. Most of the people in their groups would pay for tax prep. They don't trust that the taxes are done right when they're free, even though they didn't have bad experiences particularly. They think that free isn't professional. It's being done by someone being trained. They think they can't go back to insist it get fixed. If there's errors, they're worried about waits. They're worried about the security of their information, or that they're going to be asked to pay later on for some additional service. Next slide, please. They think paid services mean they can be demanding, that it'll get done quickly, that it'll get done right, that it's done by professionals who pay more attention and take it more seriously. Now, we all know that's not really true most of the time, right? The paid professionals they're going to are usually seasonal people with limited training who didn't particularly get training for low-income people. The VitaSite people are much more trained about the particular parts of the tax law that apply to this population. But this is the perception. Next slide, please. So they found messages, and this is why I'm sharing it with you, that helped persuade people to trust the free tax prep sites. Knowing the organization that's hosting it is a help. Using language specifically like trained professionals, saying explicitly that you'll keep their personal information secure, explaining how it's free, something like, you know, the IRS funds our program and we train volunteers. Something that makes it clear that there's not a catch. One phrase in particular is really helpful: IRS certified volunteers. The idea that it's been certified by a government agency, convincing them that these people are qualified. Good reviews from others. So think about documenting why you really are good, because people, there's a leeriness about the free services, and I wanted you to have those messages. Next slide, please. So we're going to go to Q&A, but before we do that, I have asked the folks at Prosperity Now to pop two things in the chat box for you. We took all of our message research, and based on it, we built a toolkit with lots of resources you can use for outreach. Some of it we created, some of it colleague organizations like the Center on Budget or a communications firm called GMMB or other organizations created. And so you don't even need to create your own outreach materials. You can just pull from our toolkit. And I've asked them to pop in the chat the link to the toolkit so you can just copy it and access it later. We also have a listserv where we put out new outreach materials as they become available. And so I encourage you to sign up there, and that way you'll get more information as it comes out. In particular, we'll put out new resources when the online portal becomes available in May. We are going to try and put out resources you could use to do outreach to families in summer feeding programs. We're trying to look for other avenues to reach these families that so desperately need this support. And so if you want to get new materials as they become available, just sign up for that listserv. I don't see it yet in the chat, but I'm hoping that it will get in there in a moment. And with that, I will turn this back over to Vanna.
Thank you so much, Debbie, for that great information. It's always interesting to see, sort of challenge our assumptions and see what people really think, parents, providers really think. So this was really helpful, really interesting information that I hope folks on the call are able to take away and apply to their own outreach efforts. And yes, we did post the links in the chat, but we can repost them so that they are refreshed in the audience's chat. So now I know that we only have about 12 minutes left, so I want to get to some questions here. We have a few questions that pertain to Richard, and then Debbie, I'll ask your questions as well. But Richard, question here for you, following up on the question around the map that you were showing. Since Florida is a non-Medicaid expansion state with a relatively high child uninsured rate, any suggestions on maps or tools that might be able to identify families with uninsured children? Good question.
It's a great question, and they're absolutely correct, because again, we're only able to show this count based on families with health insurance. So in states like Florida and Texas, you're going to see lower numbers because they've not expanded to Medicaid, so fewer families are getting health care, and so that drops the overall number. In fact, if you go to the map page, there's like a top 50 count of zip codes, and I'm pretty sure there's not one Texas zip code in there. I'm not sure if there's a Florida one, but it was really surprising that there wasn't a Texas zip code in there, given what we know about the state and its demographics, and what we know about these zip codes that have high counts of children at risk and missing CTC. One way of saying, unfortunately, this is the data we have. Treasury provided this one-time source. I'm not necessarily aware of another one. However, we've looked at it, and we think that if, for example, if you look at Florida and you look at zip codes where there are high concentrations of these children at risk, those are most likely the zip codes with a high concentration of children at risk. That is, the total number of children might not be, and it's probably not, it's not accurate. It's because it's giving you imperfect data. But it's not giving a perfect count, but it is probably you toward the zip codes you would want to look at to find it. So even though you're not getting the count you want, the concentration, the places where it's high, is most likely the same if we had, better data.
Great, thank you, Richard. Another question here about data specifically, and I'm going to call on my colleague Yvonne here. I believe someone in Colorado was asking, let me scroll back up here, if it's possible to get a copy of Prosperity Now's data for Colorado. So Yvonne, they're asking who they can contact. I'm going to call on you to address that question.
Sure. You can contact me. I think my email is on this webinar slides that we're going to share. And I think also I was looking at the map because I saw that question come through. And I think if you go to the Midwest, so if you go to the regional maps on the site, I think Midwest might give you the best best look of the data in Colorado. As well as you're interested in a specific zip code, you can type that in and see if you can get data on CTC and income poverty for that specific zip code if it's available.
Great, thank you, Yvonne. Let's see, and feel free if you all have additional questions for Debbie and the qualitative research that she shared, please type those into the chat as well. Richard, we had another question for you. If you could, someone says, could you please walk us through an explanation for the 5 columns in the Tax Policy Center data chart? Policyholders, children, insured, no tax. I guess there was sort of these 5 columns. I don't know if you need to pull up the screen, hopefully not, but if you could just do it from memory.
Oh, no. Okay. I will say that the most confusing term in there is probably policyholders, and this has to go with, sorry, if I call it too, we also CTC. It's an explanation that, because, we're looking at children, but I think also policyholders is the idea that, like, it's the health insurance form. So your health insurance form would say, it has 2 children on it, but you have 1 policyholder. If you go also to the bottom of the map, there's a better description that I'm going to be able to give off the top of my head describing this, but that's kind of weird form. The children are on there, and then the other forms, I believe, are pulling from the American Community Survey, basically trying to give you like a denominator, how many actual people and children are in these zip codes. So if you want to make some kind of comparisons, you can use that in the other columns. And if there's someone who has questions, they can email me directly at rauxier@urban, and I'm happy to actually walk them through it if they could use some more help.
Right, and yes, we're going to share all of our panelists' email address on the next slide. And Richard, just an FYI, your sound has gone a little bit fuzzy. I'm not sure why, but luckily the next question is not for you, it's for Debbie. Debbie, quick clarifying question here. Can you clarify how the statement about having more money was not effective with parents, that they thought how you raised your children at home was more important? Any insight there?
Yeah, so I'm talking about getting more money into the family. They just believed that I'm using close to quotes, a few $100s a month doesn't make that big a difference. We were using statements that were based on research that show that children, particularly young children in households that get an infusion of cash of $2,000 or $3,000 in a year, end up doing better in school. They're born healthier. They, are more likely to do well in school, graduate from high school, go to college. They felt that was over-claiming. They just didn't see how that, would make that big a difference. And they really believed that what mattered was what they were teaching the kids in the home, how they were raising them, what their parenting was, and not how much money was there. I think some of that is a psychological defense, right? They want to believe that even though they're low income, they're doing a good job raising their kids. They don't want to think their kids are hurt because they're not able to bring in more money. And some of it's true, right? I mean, lots of middle class kids with lots of money do not do well because they're not being raised well, and lots of low income kids do well because they're raised well. That doesn't mean that an increase in money wouldn't help the kids, but people didn't want to think it would. I hope that helps. Keep in mind it's not statistically significant, but it was certainly a common reaction across a number of our focus groups.
Great, thank you, Debbie. And I saw several people asking in the chat if this will be shared. So, and I will say yes, a recording of this will be shared along with the slide deck. And then Graham, if you could repost a link to Prosperity Now's data as well as Tax Policy Center data. I'm seeing a lot of that in the chat as well. Another question I believe I saw here pertaining to, I'm sorry, there's a lot. In our experience, the public charge issue has been a tough nut to crack. Debbie, did you all do any additional testing for potential messaging there?
We did test messages about how that's not the current law. And I think it was helpful to some extent, but people are afraid that in 2 years, the law will change again. It's a very tough nut to crack. I do think that if the immigration attorney would say that, they would trust them more. I saw a comment in the chat that immigration attorneys tend to say don't apply for anything. I think it varies on the immigration attorney. Once somebody is known to IRS, to ICE, and in the system, you know, there's no fear about ICE learning about them because they're already there. There is a public charge fear, but you know, the Trump administration never really got to apply it to people, and it never applied to people who already had green cards. So I think working with your immigration bar is worth at least thinking about, because I think some of them would be pretty comfortable saying to people, go ahead, claim it, it matters. It's your immigration status isn't at risk here. It's really was ever only at risk for a small population who was here legally, but not with a green card, but wanted to get a green card. So I think it's at least worth talking to your immigration bar. We've been working, trying to get a statement out that we could share with all of the immigration bar nationally, but people are so overwhelmed that the people who said they would help us with it have just not been as responsive as we'd hope. But we're continuing to work on that to try and educate the immigration bar nationally. But it might be worth it in your community to try and do that.
Perfect, thank you, Debbie. And we are desperately running out of time, so I'm going to flip us over to the next slide so that attendees can have your contact information, your email addresses, and we can stay on this slide so that folks have enough time to write it down. But thank you everyone for joining us. This was a lot of information. I know a lot of data, both quantitative and qualitative, but in terms of where we go from here, I hope folks who are doing outreach, who are thinking about outreach, we'll begin to build off of some of these learnings that Debbie shared, the great work that they've been doing with these focus groups, and going as we are going on into 2022 and as people are ramping up these outreach efforts, build off of what we've learned, and we can continue to share learnings with one another as Prosperity Now has a cohort, as you all are doing your individual outreach efforts. So let's continue to build off of these efforts and reach as many families as possible over the next year. Also, take a look at the link that Debbie shared, join her CTC outreach listserv, join Prosperity Now's taxpayer opportunity listserv so that you can learn more about the learnings that we'll have through our 5 cohort organizations over the course of the next 3 years. And then, like I said, reach out to our speakers. You've got their email addresses there on the screen. I realize this was a very popular topic by the amount of questions and conversation that we have in the chat. We're going to send out a survey at the end of the webinar. Please let us know if you all have a desire to continue on this topic, to build on this topic, do a similar webinar like this in a few months. We are happy to take that feedback into consideration. But again, thank you so much, everyone, for joining us. I hope that you really enjoyed today's webinar. I hope you'll take the links that we shared and move forward in your own work. And yes, thank you so much to our wonderful panelists for sharing your insights and expertise with us. You all have a great rest of your day. Thank you.